All right, webinar has started. Here we go. Come on in and get comfortable, folks. We're going to start seeing y'all show up in the attendees list. So, welcome. I'm Erin. This is Danny, and we're here to take you through a conversation around getting a job as a health coach, which I think is really exciting. I'm personally very excited to be having this conversation because for a long time, well, for most of the time, the path to the path for a health coach was the entrepreneur path. It was kind of that was the path. You're going to be a health coach, you're going to go into private practice of some kind. You're going to work with clients, you're going to maybe start a business. And over the last few years, more and more and more jobs have shown up. Personally had an Indeed.com job search set up for health coaching jobs for probably the last 4 or 5 years. And every day I get emailed job listings for health coaching jobs. Now, some of them aren't winners, I'm not going to lie, but we're going to talk about that today. We're going to talk about all of it today. So I'm your coaching and curriculum director here at Primal Health Coach Institute. Danny is a subject matter expert on this. And it's interesting, when we were looking to help educate health coaches around getting a job, it's like, well, what kind of person could help us create a curriculum for this? And Danny came to mind because Danny has worked in the role of hiring health coaches for an organization. So, Danny, do me a favor. We'll throw it to you. Just fill us in on who you are and why you're here.
Totally. So I'm excited to be here. Thanks for having me, Erin, and hello, everyone. Like Erin said, my name is Danny Coleman, and in 2019, I actually got recruited by a larger fitness organization that they sold supplements, they sold workouts, and I was like a lot of you. I was kind of doing the fitness hustle. I was in the gym, personal training. I was doing a lot of sort of makeshift health coaching on my own and just trying to put all the pieces together. You know, the fitness hustle, Erin. It's like you're running around. You'll take any job, any client, figuring it all out. And I got actively recruited by this organization who said, look, we think coaching is the next evolution. It's still kind of green. We're trying to figure out what it could look like, but we would like to bring you on and build out this entire leg of our business. So it was a really exciting opportunity for me for multiple reasons. I got to build out a curriculum and programming. I got to hire trainers and coaches because I was in the trenches for so long. I knew good trainers and coaches. And I knew like a lot of these people, like the people who are hiring me, they're a little higher up. They just didn't know a good coach from a bad coach. And I was really excited about the opportunity to bring on a team of people, train them up, and sort of teach them how to coach what was going to be our coaching philosophy. So it was an incredible project. It's still one of the things I'm probably most proud of to this point. Just the relationships I built with those coaches, the program that we built together. We ended up building into $1 million health coaching program, leg of that business. And yeah, it's just something I'm still really proud of, even though I've sort of moved beyond that now.
Yeah, cool. Now, one thing you mentioned there in exploring that is because coaching was kind of fledgling. I use that word a lot. I don't know. It's just the word that comes to mind. There was sort of a lack of awareness in the industry generally as to what is a good coach and what is a bad coach, separating a good coach from a maybe less than good coach. Can you speak a bit more to that? What in your mind is a good coach?
Yeah, so there was a model that I really liked, and we talked about this a little bit in the course that we've sort of built out here, Erin, is we call it the 3 R's. So there's a lot of ways to be a good coach. And one of the things, let me back up a little bit, actually. So we start by just assessing the industry as a whole. And that problem that you just brought up is the problem. Like, how do we even assess what's a good coach? There's very little regulation even still. There's very little barrier to entry. I mean, I'm sure a lot of you on this call have seen this. People hop onto Instagram on a Tuesday and go, I am a health coach now. No certification, no credentials, was an accountant last Thursday. Now they're here to ready to bring the health coaching because they have a passion for fitness. And there was no differentiation on what made a good coach and a bad coach. It's really hard to measure these things. And just people just didn't even know what a health coach was. I talk about in the course that we understand what a personal trainer is and does. We show up to the gym 3 times. They'll take us through 3 sets of 12 of squats. They'll correct our form. We kind of understand the other end, telemedicine. I'll meet my doc. I'll get diagnosed. I'll get prescribed. But what's this gray area of a health coach? So once we understand just the landscape a little bit, then it does bring up this question, what is a good coach? And I like the 3 R model. It's from this guy. Have you heard of Brendan Bouchard,
Yep.
Erin?
Yep.
Yeah. So this is his framework that I applied when I was hiring health coaches. So basically, there's three categories in which you can be a good health coach. Ideally, you're in all three of these buckets, but you can be in any of the three. The first one is the role model. It's like, look, I've done this myself. I've had a transformation. Here's the system I use. You can share that and coach people on that framework. That's probably the lowest tier of the three, to be honest with you all, but it's a good win. You have demonstrated your expertise on someone, even if that someone is yourself. I have done this. This is my story. So the role model is the first R. The second R, which I was this was my R when I started. Now, it was the researcher. I read every book. I read every research article. I took every certification course. I was all into the education. So when I first started as a personal trainer, I didn't have many clients. I didn't really have a huge personal success story. I've always kind of liked fitness and was just always kind of into it. So I was a researcher. I was sharing the studies. I was sharing the insights. I was sharing the science. I was sharing all this stuff with my clients. That's another level of expert. And then the third level of expert, probably the best, is the results getter. So you've actually worked with people and you've delivered people outside of yourself results. So I started looking when I was combing through these resumes to hire health coaches, I was looking for these three things, whether it was a role model, whether it was a researcher, whether it was a results getter. Those were kind of my filters as I was searching through. And obviously, if I found someone with all three, personal story, I walk the walk. I read the research, I get the certs, and I have experience working with clients. That's the triple threat. That's what I really started to find as, okay, this is someone qualified that I would like to at least continue a conversation with.
Cool. That's cool. I bet you a lot of folks here relate to being the role model, which, as you said, is like that low hanging fruit. That's probably in a lot of cases what nudged us into health coaching in the first place, was having a personal experience.
Totally.
I do know that primal health coaches love their research. The results getter one is interesting. I think that's probably where a lot of coaches might feel some sense of like imposter syndrome from the perspective of, well, I haven't helped anyone yet. What do you say to that?
First of all, I say it's totally fine. I think there's nothing wrong with being the role model and being inspired and being like, I would really love to help other people. And by the way, that does make you credible. It really does. You have some sort of thing that worked for at least one. So I think first, just give yourself a little bit of grace here. Be like, okay, take a deep breath. Like there's a lot of coaches out there without a ton of experience. It doesn't mean you can't play, I guess is the point. Just
Yeah.
because you don't have a ton of experience doesn't mean you can't get into the field. So I think give yourself a little grace. And then two, I would say there does have to be some sort of implementation. Now that can be like hitting your friends up and being like, let me put you through this program. Will you guys be my guinea pigs? When I first started as a personal trainer, I was really young. I was in high school and I ran around all my entire neighborhood, training moms, training my friends, training anybody who would say yes. My poor mother, I think I still blew out her knee. I think she still has knee problems from way back then, which not a good look, but it just got me the sets and reps, right? It just got me the ability to get in there and practice this stuff. I remember when I first got certified as a personal trainer, I was driving home and I was like parked at a light and I just got on my phone at the light, wasn't moving. And I like scroll on Facebook and I see that my sister, who was also a certified trainer in the area, posted on Facebook, tagged me and said, hey, my brother, Danny Coleman, is now certified and he's giving away free sessions for the next 2 weeks. Who wants in? And whoever commented, I was supposed to follow up with these people, schedule sessions with them, and take them through a workout. And I was doing workouts outside too, Erin, like
Right.
set of dumbbells and a mat. And very quickly, you can get a couple sets and reps. And you don't have to communicate this to hiring managers. Be like, hey, I only trained my mom. But you can say, yes, Mike, speak to them as if they're your clients, even if they're for free, even if it's for $5, pay what you want, even if you just meet someone online, be like, hey, here's a workout program. When we start becoming health coaches, a lot of people start to reach out to us too. If you sort of put yourself out there, hey, I'm doing workouts. Hey, I'm putting together nutrition programs. You'll be surprised how many of your current circle will reach out and be like, can you put together something for me? And the answer should be yes, I
Yeah,
will. Even if they don't
exactly.
do it, even if they don't follow through, even if you mess up, it's not great. Just do it and say yes.
Yes,
We'll do what I
absolutely.
would say.
It is about getting those reps. So I want to actually back up, and just for the benefit of our live audience and anybody here who's catching this on the replay, why are we here? What are we here to talk about? So I invited Danny here. Danny is a subject matter expert in the realm of seeking and hiring health coaches into organizations. We're here to talk about health coaching jobs. Okay, so as I kind of kicked off saying, it's back in the day we started out, it was always the entrepreneur track, but lately we've been seeing more health coaching jobs. And as health coaching educators, I've been hearing from coaches who say, I want to be a health coach, but I don't think I have what it takes to start my own business, or I don't want to, maybe not now. Are there jobs? And the answer to that question is yes, there are jobs. There are more jobs now than ever before. So we are here to talk today about health coaching jobs. And just to give you guys the sort of indoctrination, the introduction, we've created a course. It's going to help you land a health coaching job. It's going to teach you how to set yourself up to apply. So getting, your resume, your reps in, collecting and distributing, if you will, your credentials, your expertise, how to find jobs, how to interview for jobs. We've got this all packaged up into a course for you that for Primal Health Coaches, which is everybody watching here, you guys are going to get it for free. So as soon as we launch it, it's going to show up in your student dashboard and you're going to get a chance to just rifle through it. Danny was our author for this course. That's why he's here. As you can tell, he knows a lot about this stuff because how many people, I mean, how many interviews did you do? How many coaches did you hire? How many interviews did you do? How many? Like hundreds?
When I was hiring my
Guys?
team.
Yeah.
Yeah, so that's sort of what we try to get at the core. So I start by sort of sharing. I share at the beginning of this my story. I was hired on to build out this health coaching team. I did not have a ton of support. They were like, "Go do it," and so we put up a job posting. I don't even think we weren't even on Indeed. It was something called Workable that I think may have spread through Indeed or spread through LinkedIn, and then it kind of centralized into Workable. I don't even know how the system worked, but I know that I had 1,400 applicants pretty much in 3 days. It was
Whoa.
wild. And I was expected to sort through all these applicants. And I ended up whittling it down to 50 something. I had escaped, 53, 54 interviews that I scheduled. Of those interviews, we whittled it down into about 15 finalists that I had my boss have a conversation as well. And then we ended up giving 12 of them what we called a test project and basically said, all right, let's see you apply some of the material you talked about in your interview. And we ended up offering the job to 10 health coaches to start building out the program with. So you can see how it's like, my boss loved to say, like, you had a better chance of becoming a Navy SEAL than a metabolic health coach is what we called it, which I was like, that's a little far-fetched, but statistically, I guess he was right. But just to whittle it down into the final 10 from 1,400, it was a serious process.
That's a tremendous amount of whittling.
Whittling.
I I,
It
I
is.
think people are going to wonder, as am I. So 1,400 applicants became 53 invitations to interview. So how did those 53 make it through? Like generally speaking.
Yeah, generally speaking, this is essentially what the course we built does, Erin. It talks you through how do you end up being in the pile of 1,400 and whittling it down into being whittled down into the 53 or even the 10. And so then the course walks you through exactly how to do that. So at a high level, I think maybe we can talk about the mindsets a little bit that
Yeah.
lead to the behavior. So
Ooh,
this is something we
let's do
talked
that.
about in the course. And there's really these three mindsets that separated the 53 from the pack, at least on paper. And then it kind of continued on the interviews as well. So number one, and this is really important, is competence over passion. And this is really hard for health coaches because we do this work because we love it. We do this work because we want to make a difference. That is inherently emotional. It's inherently passionate. And there is absolutely nothing wrong with that. I actually love that. I do want coaches to be passionate, but when you're applying for the job, if you are highlighting your passion, unfortunately, that's not going to get you to the next level. We need to see competence of some regard. And that's what we're talking about, the 3 R's. Have you demonstrated competence in some regard? And then can you communicate that effectively through your resume, through your application questions, through the interview process? So it's just I hope that distinction makes sense for the audience right now. It's like, it's great that you're passionate, but so many applications says, I do this because it's my purpose. I do it because I love it. I do it because I want to make a difference. And that's wonderful. But me as the hiring manager has to make a distinction between who's qualified for this position and who isn't. And all 1,400 applicants were passionate,
Yeah,
all 1,400.
that's
So
table
I had to
stakes.
have a system to get people down. So the competence piece is talk about your experience, talk about your actual results getting experiences, talk about the researcher element of things, your certs, your education, all the things you're learning in Primal Health Coach. Highlight those things. That's a competence trigger. You're demonstrating that, hey, I have competence in this. So that's a big one. I hope that makes sense. The second one is proactive over passive. And this is a hard one for a lot of us too, because we think we're being annoying or we're getting in someone's face. But I was going through 1,400 applications. I needed someone to wave their hand and be like, this is the interview you need to take. So there's a quick story. I tell this in the course too. One woman who applied for the job ended up recognizing my boss, basically. So my boss was a public figure, recognizing him in public. I guess they lived in the same town. Just walked up to him and said, "Hey, I want to let you know I applied for the health coaching job, but regardless, I love what you all do. I'm a huge fan of your work, and I would love to be a part of it. Even not, I've taken your education and this and that." And they just had a brief conversation in a hotel lobby. My boss immediately called me and said, "You need to interview this person." And I was like, "Okay, done, scheduled." That's one of the 53. I hadn't even looked at her resume yet. Now I did after I got the call, but I didn't even look at the resume. That's an example of proactive behavior that's a little uncomfortable. Another interview I did was because someone actually reached out to me on LinkedIn and said, "Hey, I applied for the job." It just triggers me to be like, okay, let me go look at your resume. You stand out. They came off as positive and professional. Or I had one person apply for the job twice, which moved her resume back to the top of the pile. I was like, I think I've seen this person
Oh,
before. So
nice.
these little cues are kind of weird. They make us uncomfortable, but things like reaching out, things like lying twice, things like sending a note and be like, "Hey, I applied for this position," seeing someone in a lobby, be like, "I'm coming. I just want to introduce myself," and put a face to a resume. Do a video. I had someone do a video like, "Hey, I applied," didn't ask for a video, but they did a
Right.
little video. These little extra steps, I would say, is a proactive mindset rather than just saying, "Okay, I applied. It's out of my hands now." It's not out of your hands. You actually carry a lot of influence if you take a little bit of action. And it really doesn't take much. A 1 minute video, that's not a huge amount of effort. Introducing yourself in a lobby, not a huge amount of effort, but that was huge for me as a hiring manager. And then the third one, I try to put this delicately throughout the course, but you have to become a giver over a getter, is probably the third mindset. And a giver is thinking through. So we talk about empathy a lot as coaching,
Mhm.
as coaches, but I really like perspective taking even more, is not feeling what someone's feeling, but thinking how someone's thinking. So I talk about this in the course. As a hiring manager, I am busy. I am building out the curriculum while I'm also hiring coaches, while I'm also building a train the trainer curriculum, while I'm also trying to bother sales to get our program on the docket and make sure everything's set up. And I'm also trying to look good to my boss and make sure like these coaches are going to reflect on me. And that sounds egocentric, and it is. It is egocentric. But if you can position yourself throughout your application, throughout your resume, throughout the interview, here's how I can help. And a lot of it is speaking to some of those industry challenges. Hey, I know there's zero regulation, but here's all my credentials. Hey, I know it's a low barrier to entry, but I've had a lot of success with real world clients. Hey, I know people don't know what health coaching is. I can articulate it very well. Doing things like that make my job as a hiring manager a lot easier. So I would say those are the kind of the big three mindsets or actions. Mindsets lead to actions, right? So those are the big actions that really stand out. That makes
And so
sense.
that's awesome. I just love
Cool.
it. Anybody who's watching, if you have questions, by the way, we're going to do a Q&A portion here, so feel free to type it up in the chat and the Q&A panel, and I'll come around to it later. But my question for you, maybe this is on the minds of some of these folks, is um, specifically with respect to competence over passion and giver over getter. Are we articulating this in our cover letter, in the resume somehow? How are we positioning ourselves so that the hiring manager knows that we have these mindsets?
Yep, everywhere. So it's sort I see it sort of like a seasoning. It goes cuts through your resume, it cuts through your post application behaviors, it cuts through your conversations in the interview, it shows in your test project as we took people through this whole process. I would say that's why I like the idea of mindsets, because it's more like it's more of an embodiment, right? If I see the world this way, then everything I do will act in line with that. If that makes sense. So if the mindset principle is gravity, I don't need to know all. I know that I probably shouldn't jump off a bridge or a building. I know I probably shouldn't run really fast with a knife facing upward. So the principle or the mindset, the
Right.
framework guides all the little behaviors.
Got you. Good analogy. One of my favorite things that you lent to the course was the lessons from a hiring manager. And maybe some of this is going to be, overlap from what we just talked about, but I just thought this was just great. So we had these three lessons that you shared. Lesson number one, don't give the hiring manager an easy reason to discard your application. So ostensibly 1,350 people did that when you had your 1,400 resumes.
Yep.
So, we want to this proactive versus over passive, what can you put in your resume? What can you put in your application to make sure that you're seen? But what would be the reasons why you might be overlooked?
So I think it's really important for everybody on this call to know the average time that a hiring manager looks at a resume is 5 seconds.
Whoa.
5 seconds per resume, going through, especially when you have 1,400. And I probably, if I'm being honest with you all, 5 to 10 seconds scanning, looking. So in order to do that effectively, I need little rules in my head to be like, this person's out. So this is why you'll see a lot of jobs be like, put this in the subject line. Put a smile, put an emoji in the subject line. They're looking for these easy rules to discard you. And the number one easy rule to discard is really just I guess you would say it's grammar, it's
Yeah.
punctuation, it's just organization of a resume, it's just misspelled words, and it seems small and relative. Frankly, it is small, and I probably passed up on a lot of great coaches. But when I had this huge psychic load, I had to figure out, I had to whittle, as we
Yeah.
say, and I had to whittle it down somehow. So I think the number one thing is just don't give me an easy reason to say no. Make me actually go from 10 seconds to 2 minutes to look at your resume. Have
Yeah.
it organized, have it well spelled. I would probably say 60% had a jarring grammar issue. I'm not a grammar expert, so I wouldn't, if you use a semicolon wrong, would have missed me. But if you had just a grossly misspelled word, or just like a huge space in the resume, which I thought was bizarre, I just go, these are easy ways for me to say no. So the first thing is take your time. If you really want to do a job, there is going to be there's going to be some uplift. There's going to be some energy output up front. It's going to make sure use tools like Grammarly, take your time, organize your resume so it makes sense. Put your features at the top, like your 3 R's up at the top, your results getter, your researcher, and your role model stuff. Make it so it pops out. So just little stuff like that. It's really not earth shattering insights. We talk about this in the course too. These aren't going to blow your mind, but what does blow my mind is how often they happen. So I think the first thing is just is grammar, punctuation, spelling. Don't give me an obvious reason to say no. If there's instructions, follow the instructions. If there's application questions, take the time to answer the application questions. And same thing, spelling, grammar, etc. And be thoughtful too. So I had a couple of people answer the application questions with 2 words. I had to discard. I just had to have simple rules for myself to get through. So I would say that's the first lesson we talked about.
That's
Anything
good.
to add, Erin? I mean, I know you have insights on this stuff as well.
Yeah, I was gonna say, well, one of the contributions I made to this course, folks, is I take you through some job postings and how to read the job posting, what they're asking for. Would you be qualified for this one? Maybe, maybe not. What to look for, how to research the company that's hiring, so on and so forth. And what I was noticing, by the way, there's in my inbox, I have hundreds and hundreds of health coaching job postings. I've been saving them for the purpose of this course, and more of them are putting little tests in to apply for this job, you know, in your application email, do these three things, or literally put this emoji in the subject line or this turn of phrase in the subject line. If you overlook that stuff, you'll be immediately discarded. On the other end of that application is not somebody who's excited that a passionate health coach is just another passionate health coach has turned up. They have a lot of deliverables they themselves have to meet, and so we have to show up and sort of do our due diligence, do our uh, fully embrace what's been asked in the application. And I'm just wondering, because since you're looking at the resume, for the hiring manager's looking at it for 5 to 10 seconds, um, this is such a small question, but probably on the minds of a lot of folks. But like, does formatting, obviously, like giant spaces and weird spaces visually on the
Yeah.
resume looks weird. But I mean, should we be using a cute Canva template or something simple like that? What do you think? Does it matter?
I, I'm probably indifferent on
Yeah.
that, Erin. I don't want to say it doesn't matter. Anything that gets it to pop, I think could add some value. I think for me, the key feature, the first thing that I looked at was the most recent job. And this was
Yeah.
another kind of trick to easily discard. And again, I'll share this with all of you just to be transparent. Not that I'm proud of this, but it's just what I had to do to get through these applications. But I saw a lot of people who are nurses or nurse practitioners,
Mhm.
and that was the feature job up top.
Yep.
So it's great. I think they would offer a lot of value. I know for a fact, I actually had a nurse I ended up hiring, but she kind of curated her resume in a different way. They have unbelievable bedside manner. They have unbelievable interpersonal skills. They have incredible a knowledge base. But unfortunately, if the feature job is nurse or feature job is accountant, I need someone who's kind of already in the arena to some
Yes.
degree. They're training, they're coaching, they're trying, and that needs to be the feature position. So that's the first thing I looked at, not education, not even certifications. It's actually the role, your
Interesting.
feature role, the first role that I see up top, I looked at. So if it was nurse, teacher, I got a lot of accountants.
Yeah.
Again, this is the passion mindset. I'm an accountant, but I would love to help in
Yeah.
fitness. It's great, but I had 10 positions to fill and I had a lot of other competing priorities. So again, I needed tools to kind of filter through. So I'd say just focus on that top piece. What's the role? And then qualify that role. What did you do? How'd you make an impact? Results, things like that.
I love that. That's so powerful actually because health coaches often I would say in a high percentage of the time are transitioning from previous career. It's just such a new career path
Totally.
that people are kind of transitioning into it from a previous career. Not that we're not discarding your previous career, but what I'm picking up is the first job on your resume should be health coach. So then how are you going to flesh out your competency um, such that you can have that as the top line on your resume? So
Yeah.
that's
So
putting in some reps.
this speaks to, yeah, it speaks to more the brand new health coach. So yes,
Yeah.
make your top job a health coach, even if you started yesterday. It's
Yeah.
basically 2024 health coach. And
Mhm.
then you qualify that with the 3 R's. So if all you have is a certification and a personal story, that's what you share. Be like, I have personally lost 50 pounds and changed my habits. And then I taught 5 clients, and they could be your mom and your best friend. Does it just say client? I've taught 5 clients how to eat similar to me, and they're on the journey as well. I've been certified through Primal Health through this particular certification. I also have this educational background. Whatever it is, try
Mhm.
to beef it up in that regard. So it's basically a health coach, and then whatever you have within the 3 R's, that's the top sections.
Yeah. Cool. Very useful. Your second lesson, which we've touched on a few times, but it will be that the hiring manager's priority is to look good.
It is. It is. It may be egocentric, it may be vain, but my number one priority is I knew that I had to pass along these candidates to my boss who hired me, and I knew that would reflect on me. And then two, I needed coaches that were going to deliver a great service for the program, because if the program fails, then I'm out of a job. So
Right.
my priorities were that I'm playing the game just like the rest of us, right? So those were my priorities. And I remember I had this one guy, Aaron, and this was he's as close to a genius that I've probably ever met. I was blown away. He was younger guy, like 23, 24, and just the way he communicated everything he knew. He was able to take very complex science and break it down very simply for even me. It was beyond my
Awesome.
scope. And I was like, wow, this is unbelievable. I thought this guy was a mad genius. And I do use the word mad intentionally because on the call, it was like a hot pocket plate. It was like, I think he had bedhead, like his bed was like all flipped over, like he had a lava lamp. And it's no judgment on any of that, except there is a little bit of judgment in a professional setting that I'm going to pass this dude on to my boss. Also, what will our clients think, no matter how smart he is? Does he have the ability to have a little bit of professionalism? So unfortunately, I didn't pass this guy along. I even remember calling my boss, being like, I think I have a certified genius, but I don't think I can pass him along. I don't think it would reflect well on our
Right.
client. So I don't think
Yeah.
I will. So I think just keep that in mind, that yes, you're working with human beings who have egos. They are vain. They're trying to keep their job. They're trying to look good. We're trying to build a world-class health coaching program, and my fingerprints were going to be all over it. So I knew that these coaches were going to be a part of the program, part of me, part of really my life in a lot of
Yeah.
ways. So there we are, egocentric. And so it's just to keep in mind, again, it's that being that giver over the getter. So how do you position yourself to support that person and understand that they have a lot on their plate and make decisions easier for them, all of those things. So that's
Yeah.
the second lesson we talk about.
Yeah. I think that's just a question of thinking big picture. I don't think it's egocentric for the hiring manager to say, I'd rather you didn't have a messy bed in the background of the Zoom call.
Right.
Um, I think that's pretty brass tacks. Ultimately you're applying to be a health coach as part of an organization that wants to become world class so people can get healthier. Isn't that the passion that drove us all here? So, you're not just a health coach. You're part of this larger mission driven organization. And so show up as though you wish to be really a crucial part of that mission.
Totally.
Okay, lesson three is my fave. Okay, lesson three from a hiring manager is my fave. The three things a hiring manager is looking for. There were three things: technical skills, which is the one I'm specifically very excited about, and I'll weigh in on my own editorialization once you've had a chance to. Professional skills and interpersonal skills. So take us through those three things.
Yeah, so I hope I didn't confuse you with the titles here. When I'm talking technical skills, I am talking, do you have the ability to do the job? And do you have the ability to coach? Do you understand how to synthesize the data? Do you understand how to assess a client's health? Do you understand which tools to match to which issue? Do you have the technical skills to coach? So this is why certifications are great. This is why experiences are great. And when I say technical skills, I also want someone who understands how to log on a Zoom. Again, don't give me an easy reason to eliminate you. I had 3 or 4 of those interviews come on and be like, sorry, Zoom really confused me. And I'm going, all of our coaching calls are on Zoom. If
Yeah.
you can't, I can't be your tech support. So technical skills mean, can you do the job? So yes, can you coach, but also can you just manage the technology? So don't show up to a call where you're working for a virtual health coaching company and be like, I'm not really that tech savvy. It's like, well, our whole business exists on a tech platform, so I need you to be tech savvy. So technical skills is how I classify that bucket. I say professional skills, the second bucket here, as it's don't have the hot pocket plate in the background,
Right.
don't have the unmade bed, right? It's organizational skills, like someone who gets on and goes, I'm not detail oriented. Again, I had to eliminate, because even if you're not, I need you to be. I need you
Mm-hmm.
to be able to organize client data. I had HIPAA compliance rules that I had to be in charge for. So videos need to go in the right place and be recorded in the right way, and distributed in the information need to be distributed in the right way. All of those things were of the utmost importance. So I needed to know that you were organizational, that you would show up on time. And again, these seem like obvious things to all of us on this call, I'm sure of it, but it was surprising to me how what's that saying, Erin? It's like the well known but not well practiced, or something like that. Common sense but not common practice, or something like that. And that's essentially what we were running into with professional skills. And it's like someone showed up, wouldn't turn their video camera on. I'm like, hey, you mind turning the camera on? Just this is how we'll do these calls face to face. She just goes, no. I'm like, okay.
What?
Yeah, it was just bizarre, right? These little things that allow me to say, sorry, then I can't advance you. So professional skills are really, can you be a professional? Which, if you are, this is actually a good point to bring back to, if you are an accountant, if you
Mm-hmm.
are a nurse who's been working shifts in a hospital, that's your competitive advantage. You
Yes.
are a professional. Like I didn't want the genius in health and fitness who had the unmade bed and lava lamp in the background. I wanted people like you all who showed up to work on time, who were professionals, who were the adults in the room. I knew I could not manage hundreds of clients. I needed to rely and trust that there was an adult in the room. And sure enough, most people I hire were 2 times my age when I hired them. So because I wanted adults in the room. So that's the second bucket. And then the third bucket, interpersonal skills. Can you interact with people? So much of coaching, as you all know, is just connecting with people. It's about people. It's an interpersonal process. You have to be able to connect, empathize, listen. And unfortunately, I didn't have the time to teach those type of skills. I do think they can be taught, developed, all of those things. I just didn't have the time. So I needed people who could have a conversation. So at the end of the interview, I love when people go, I do have some questions for you. I am prepared. I did kind of show up. There's this interpersonal skills. They asked me questions about myself. They listened to the questions deeply. They had this innate sense to understand instantly. Go, I totally know what you're talking about. It was just this interpersonal ability to connect. And by the way, that woman who approached me or not approached me, approached my boss in the lobby, I interviewed her. This woman was the least experienced coach. She was the accountant in the room. She was least experienced. She just got her certification. She was retired tech sales who ended up just being like, I want to do this for fun. So again, passionate, overconfidence, all that. She broke all of my rules, but she was a superhuman connector.
Right.
And I was like, I just got to pass you on. I love you. I think you're just so, you can connect with people. We can teach you the health and fitness stuff.
Yeah.
That's how I felt. But you have the ability to connect with people. It was so powerful. And interestingly enough, this woman was the top of our KPIs in every category: in client retention, in client results, in customer feedback, all of those categories. She was number one. And I tend to think it's her ability just to connect
Yeah.
with people. So they share more, they open up more, they stay on longer because they have an affection for her. So I think that's the third important skill.
Cool.
So yeah, what do you have to add to
I
those,
like
Aaron?
that. Well, first of all, on that last point, I You mentioned this, and I fully believe this, that the interpersonal skills, the empathy can be, you can learn it. You can learn it. You can practice it. If it doesn't feel like something that you have a natural inclination toward, it can be learned. And I honestly think a good coaching education will help bring that out because there is just so much empathy built into a effective coaching relationship. The one that I was, this is sort of a hill that I'm going to die on. So the one I was most excited about, my personal crusade, is technical skills from the perspective of using technology. And the
Mm.
only reason I want to bring this up is just maybe because in our community of primal health coaches, we tend to be a little more analog. And I always hear coaches say, I'm not that tech savvy. And my response is, it's 2024. You're going
That's
to have to be a little tech savvy, just a little bit. I'm not asking you to program software. I'm just saying, know how to use Zoom, be kind of unflappable when technology inevitably jerks you around, which it will do. Yeah, Zoom is going to want to reboot and update itself in the middle of your session or whatever. It's going to happen. But like, I just don't, I personally don't accept low technical skills in this day and age. And the thing is, when I was looking for the jobs to include in the course, most of them are remote. Most of them are remote virtual coaching. Yeah, you can go work in an office. There's definitely lots of medical clinics, functional medical clinics, integrative medicine clinics that are bringing health coaches physically into their physical location. Those jobs are absolutely available to you. But the greater pool of jobs are virtual. So you're going to be on camera, you're going to be on Zoom, you're going to have to figure it out. And I just want to put that out there. It's just we can't really be untechnical in this day and age.
I I
Sorry.
double tap on that. My other one is detail oriented. If you
Mm.
say it's not, I'm not a details person. I hear that one a lot as well.
Oh wow.
Again, it's not a genetic code. It's a practice. So get a little bit detail oriented, get organized. Because we were collecting client data. I need to know that it was accurate. I need to know that we can deliver this information to the sales team. Like, here's how effective our program is. Push it harder. So I needed it as evidence. So those two, I'm not tech savvy and I'm not detail oriented. I would challenge all of you, respectfully challenge all of you to sort of reframe that a little bit. You don't have, again, like Erin said, you don't have to be a computer programmer, and you don't have to be an SEC level organizational person, but you do need to be able to organize client data and client notes and have things tight. So those two things. But double tap on what you're saying, Erin, for
Yeah,
sure.
yeah. Cool. I honestly, the detail that you brought to this course is just awesome, and I can't wait for primal health coaches to get access to it. I wanted to save some time for just some Q&A. There's so much more we could talk about, but I think maybe diving into some questions would be cool if you're up for
Yeah,
that,
totally.
Danny. So we had some of you folks pre-submit questions. We're going to run through a few pre-submitted, and then I'll see if there's any cool ones here on the live feed as well. But let's start with some of these questions here. Well, Brad asked a question that we've kind of articulated a few times. Let's just reiterate it. How to stand out and be the one chosen in a very crowded field with lots of applicants, which I think is going to be the case. I mean, you had that experience, Danny. Um, I think for most jobs that you apply for, coaches, there's going to be a lot of coaches, and you're going to have to figure out a way to rise to the top. We've already talked about this a lot, but like high level summary view, what's your answer, Danny?
High level summary view, emphasize competence, be proactive, do little things that most people aren't doing, shoot a video, reach out, follow up, apply again, things like that. And then just reframe everything from being a getter, what you're going to get. I get to work from home. I get to do what I
Right.
love. I get to work part-time, to what can I provide
Yes.
the organization, those three. I would also say, Erin, just this is a part of the course as well. We didn't talk about this. We talk about creating a narrative in your resume. So it's like, what key themes you want to pop out from your resume? So I'll give an example. When I'm combing through resumes for ours, a core part of our philosophy was weight training. So the yogis in the group may not agree with that. We also we call it diet agnostic. We didn't have one path to health and fitness. So if you were like pro vegan, pro keto, pro fasting, those got discarded as well. And so I was looking for these themes: weight training background, sort of all-inclusive nutrition. Like I'm all for whatever works for the person. I was looking for these to pop out of the resume. So I think just deciding what your key themes are going to be and then working to highlight those in your resume, working to highlight those in the interview. And here's the thing too, it's not going to guarantee you get the job. It might actually get you deleted,
Right.
but that's okay because it's probably not the best fit for you anyway. Like the vegan yogi just wouldn't have been the best fit for our organization. Doesn't mean it's not right. Doesn't mean She wasn't qualified. It just wasn't the best fit. So I would just say, what are your themes? Like, what do you want to be known? When I do my resume, I want to be known as the psychology guy. Like, I wanted to stand out that I understand human beings and that I can work with human beings and I can motivate and I can influence. That was a big one for me. So then I started to pull certifications that highlighted that, or tell a story of how I changed someone's psychology through my resume. So what are your themes? What are your big buckets? Like, I am the yogi coach, I am the pro vegan coach, and I am also the my number one value is movement or walking or whatever it is, right? And just highlight those things throughout the resume. That can help you stand out. And again, it may mean you get pushed to the side, which is fine though. You want to be polarizing.
Yes. Yeah. This is actually one area where the employment path and the entrepreneurial path, I think, converge, which is, what is my point of view? What do I want to be known for? What is my
Mm-hmm.
expertise? And so I teach a beginner business course for the entrepreneurial path within Primal Health Coach Institute. And it's like, that's where we start. Like, what are you going to be the world leading expert in? And I use that language intentionally because it really throws people off. Like, world leading expert, it's like, just go with me on this. What's your expertise? What's your point of view? What's your specialty? And I think, as to your point, it's so we need to have that clarity too when we're putting ourselves out there for jobs. You want to have alignment.
Yeah.
Um,
You're
so so
marketing yourself.
yeah, it's marketing 100%. So get really clear on what it is you do, what you stand for.
Mm-hmm.
You got to do that exercise anyway. So anybody who's looking to get into a job because they're avoiding the entrepreneurial path, totally get it. But you still have to do a little bit of that sort of self-reflection and self-declaration of expertise, even if you are going to go get a job. Really crucial. Here's one for you, Danny. Amy asks, "Do I have to be certified?"
I would love your take on this, Erin. I will say it's probably really valuable because, again, remember, we're dealing with an industry that has very low regulation, very low barrier to entry. So the idea that you haven't even gone to a weekend certification course and had that energy output, whether it's time or money, I would say that it matters to a degree. The nice part is pick a certification that resonates with you because there is no standard certification. There's no standard of excellence, but I would probably say you need to be certified in some capacity unless you have just a ton of experience. Like, look, I'm not certified, or maybe your college education is more
Mhm.
around nutrition or fitness or health or something like that. But I tend to lead towards, yeah, go get certified, like lowest hanging fruit, go to weekend training, get certified in kettlebells for all I care. I
Mhm.
do need to see that there's been some sort of energetic output, whether it's time or money, towards this career path. So that would be what would you say, Erin?
So because health coaching is unregulated, you don't have to be certified to be a health coach.
Yes, good
Danny
distinction.
started by saying this. He said, you can just show up one day and say, I'm a health coach, and no one can take you to task for that. It's unregulated. And by the way, I love being unregulated. I'm not looking for regulation anytime soon, just between you and me. But when you're applying for a job, so if you're going to private practice, go for it. No, clients don't ever ask me for my credential. They just want to know that I can get results. But if I'm applying for a job, the employer is going to want to know that I'm certified. Now, sometimes the employer doesn't know. The employer literally doesn't know that health coaching is unregulated. Employers, I find, Danny being maybe the exception here, but some of the jobs that I've been looking at, when I'm reading the job posting, what I'm sensing is I don't think this employer really knows much about health coaching, quite honestly. They know they need something like that in their organization, but maybe they don't really know what it is. They're asking for certifications, so have one. Have one. What I will also add on, because this question came up a ton, and I'll just touch on this because we are unregulated. We don't have any kind of governing agency, if you will, but we do have a respected credential now in the health coaching field, which is the National Board of Health and Wellness Coaches, the NBC HWC credential. This is the board certified path for health coaches. And what I've noticed is if a job posting isn't outright asking you to be NBHWC board certified, it is asking you to have graduated from an NBHWC approved school. So employers are now clocking this sort of higher level educational credential governing body type deal, the NBHWC, and they're asking for that. As a primal health coach graduate, you have graduated from a national board certified school. We are a school that's approved by the MHWC. If you went the next level and got yourself board certified by writing that exam, then you've got a little leg up. So I believe you need to get certified. First of all, I just want you to know how to coach. You need to know how to coach. You're going to be applying for these jobs where you'll be coaching people. And I hope the kettlebell cert, any cert you're going to get is great, but ideally you're going to get a coach certification that teaches you how to enact the coaching relationship. So yeah, I think you need to be certified for sure.
Great answer. Yeah, I agree.
Amazing. Where else should we go with the questions here? Well, let's see if there's anything that came in live. Is social media necessary? What do you think about that?
I know you'll probably have some things to share in this as well, Erin. For if you are applying for a health coaching position, I would actually say no, not at all. I think that's the appeal of applying for a health coaching position, is that you don't have to be the marketing engine. You don't have to be the sales engine. You don't have to do any of that. And I will tell you all, I had 10 coaches, 8 of which didn't even have social media
Right.
at all. I looked at their experience. I didn't even check their social media. They had the 3 buckets, right? They could coach, they had the interpersonal skills, and they had the professional skills. That's what I was looking for. So I would say if this is the path you're taking, then no. And that is the plus side of going towards an organization. We're just looking, can you coach? Do you have experience coaching? No, you don't need social media. Now, what I will say is if you don't have any experience, like a lot of people have mentioned, like I don't even have a win with a client yet. Social media is going to be one of your best tools because you already have people in your circle. Just be like, who wants a free training session?
True.
I'll coach you for free today. I'll take 10 people. I'll coach you. I'll put together a workout program for you. I'll coach you up on your nutrition and I'll help you out. Who wants in? A
Mm-hmm.
great tool. It's going to be people that's
Yeah.
fine. That's how we all got started. Man, I remember my poor mother and still has knee pain from me. And I regret that deeply. I've gotten a lot better since my mother, but that's where we all start, right? We just like give out free workouts, $5 workouts, anything you can. So my answer, Erin, might differ from yours, but I say no if this is the path you're taking, not the entrepreneurial path, but for the organization path, but it can be a useful tool to just get some sets and reps.
Yep, I would agree. Actually, this is I fully agree that this is a great opportunity for the folks who really dislike the idea of growing some kind of following online. Because I hear that so much from you folks that I want to be a health coach, but I really, really dislike social media. I don't like talking on camera and flapping my gums on Instagram does not appeal to me. Then this is really a great path for you.
Yeah.
I agree. But this brings to mind another question that came in pre-submitted, which maybe we can noodle on. Um, the pay grade for these roles. I don't know. This is something that maybe I can speak to because I was looking at a lot of these job postings, and Danny, feel free to
Yeah, I'm happy to share
weigh
too.
in. But so sometimes what I'm hearing folks say is, well, I looked at this health coaching job, but it only paid like $20, $24 an hour. And I get that. That doesn't feel, maybe it's not replacing your previous income as a accountant or whatever it was. I totally get it. And I think I understand the appetite to want to completely replace your income with this new path. I also just think maybe there's an expectation management element to this, which is that jobs for health coaches are still relatively new, and there's an element of getting your foot in the door. I mean, you're making a career change. If you made a career change from a medicine to accounting or whatever to whatever, dolphin training to dog walking, there's going to be that sort of sluggishness at the beginning, in a manner of speaking, as you get your feet under you in this new career. So I just want you guys to manage your expectations around how much bank you're going to make right out the gate in a health coaching job. But truly, the pay ranges wildly vary depending on what industry you're looking at. There's things like medical and clinical jobs, private sector ones, wellness companies, corporate wellness, right? So depending on what kind of sector you're going to, the pay range varies. My perspective is generally some of these jobs are paying a little less than you're probably hoping, but it's a job in the field that you want to get into. And I think there's room to be the early health coach in the organization that can become a middle or senior leader in that role. I do believe that. I believe that these roles are going to grow and this industry is going to continue to expand. So I just want to encourage you to the best of your ability, whatever you can manage and afford in your lifestyle, to not discard a job just because the pay grade seems low, because I think it's an opportunity.
Yeah, couldn't have said it any better myself. I can share a little bit just about our specific organization, Erin, that may be helpful for your people. And this is when I started the program in 2019 and ran it through late 2022, early 2023. And we started everybody at $30 an hour. And at the time, the research we did, that was relatively high for the industry. I remember when I first started personal training, I was getting $7.12 a client for an hour session. And then if I sold a package, I got a piece of that, like a 24-hour fitness. And then even for boutique studios, I was getting like 15, $20 an hour. So to me, it was a great place to people get in. And also, I didn't understand this piece, but I talked a lot with the CEO. He's like, look, the unit economics just don't make sense. We can't afford to give these coaches $100 a client based on what we're charging, based on the marketing costs, based on what we're paying the sales out of pocket if they make a sale for your program. So there is a cap on that. Just to give you guys a little bit more context too, it's not like an evil hold all the money thing either. It's just for perspective. And my best coaches ended up making $40 to $50 an hour towards the end, which was, again, for industry standard was really, really good to
Yeah.
get these in. So this was probably the top 1% of pricing too. We charge a lot for our programs, and it still was not a huge amount. But I love what you said, Erin. It can just be, especially if you don't have any sets and reps in the game, just get client experience, use it to your advantage. And so many of my coaches jumped their own platform after that. Like, okay, I get how this
Exactly.
works. Now I can build my own apparatus.
Okay, good. Two things I wanted to pull out there. First of all, that last thing you said was there is going to be a percentage of you that do a job for now until you're ready to go out on your own. And the job might be just that leverage point to get you the reps, the confidence to then go out on your own. Maybe you're doing this while you're building your private practice on the side, right? So you're doing that. It's an awesome way to do it because I mean, when I built my private practice, I still had a job. I still had to pay the mortgage. I wasn't going to leap into entrepreneurship. So this is a nice little tiptoe into entrepreneurship for those of you that eventually want to do that, but maybe aren't ready right now. The other thing is we have to zoom out and look at the industry as a whole. And I'm talking like all the way out, zoom out to the health consumer, right? The client, the person. Every year, humans, health consumers, are getting more savvy to the idea of if I really want to be healthy, I might have to pay out of pocket for a program. Every year, this is becoming more the concierge sort of health and wellness world, or the out of pocket. The insurance companies aren't helping me out, so and the medical system is I'm lost. So they're kind of branching out into these sort of these programs that are using health coaches. I just see this growing. I see the whole industry growing. Maybe people paying more for the programs that have the health coaches. The integrative model is going to become more attractive. The health consumer is going to become more savvy to the idea of paying out of pocket for services. So I just think there's only growth on the horizon for these jobs.
Yeah. Well put.
Okay, let's see what else we got in the questions here. Um, April asked a question. I'm trying to make sure I can interpret this correctly. She says she talked to a dietitian who was shunned by the medical community because she wasn't teaching standard medically accepted diets. She was a keto dietitian. So this is probably a pertinent question because a lot of primal health coaches, you talked earlier about diet agnostic, right? Your program site, diet agnostic. And when you said that, I was thinking, we should probably pull this in for a good talk with the primal health coaches who do tend to skew a little primal paleo, keto, carnivore, low carb fasting. So primal health coaches do tend to have more of a specific nutritional point of view. My hunch on this is, you'll find jobs that are speaking to the low carb ancestral model, but they're few and far between. So if you're going to wait for those jobs to show up, that's okay. If that feels really, really important to you, wait. If you have some wiggle room, if you could become a little more diet agnostic, not to the point of pendulum swinging away to something that you completely don't agree with. But if you can be a little bit more into that sort of gray area, whole foods kind of vibe, then the opportunities are greater for you. What do you say to that, Danny? For coaches who do have a specific, I mean, you did touch on this earlier. You don't want to discard what is important to you on a values level, but how can we soften our bias, I guess, to make ourselves appear more attractive to more employers?
Yeah, it's sort of like that quote. It's be intolerant with yourself and be tolerant with others. I kind of perceive it like that, Erin. So have your hardcore values. If you believe, like, look, fasting is the secret. People need to be doing this. I believe that wholeheartedly. but you don't want to start your own fasting company, and based on this principle, you want to apply, hold those beliefs strongly, but you got to free it up when you're with your public face. You just do. You have to embrace people's beliefs. So for us, like, we dealt with a lot of people who never lifted a weight in their life. And that was one of our core tenets. We thought resistance training was essential to the fat loss process. We did not come in and be like, what you're doing is nonsense. Here's a 12-week weight training program, right? So we softly embrace where they were at. Okay, what are you doing now? Okay, what about walking? Was that comfortable? Oh, you like yoga. When's the last time you went to a class? Would you go 3 times a week to yoga? We just got them back in the pattern of moving. And over time, as we build trust, we could start to introduce some of those things like weight training. We could introduce, like, I love this piece that you love about fasting, but here's what we would recommend. So I think if you can build the trust, then you can start to introduce some of the more edgier pieces. So it's like, be what you're going to be, live how you're going to live, but you have to be a little bit tolerant, at least at first, and kind of be open, especially if you're applying for the job process. Because like I said, I just wasn't hiring someone who's like, veganism is the only way. I couldn't afford to,
Right.
because we're going to deal with clients who are going to be eating meat.
Yeah.
So I guess I'm not sure I understood April's question correctly, but that's sort of my take on
Yeah.
sort of what you share.
Yeah. This question came up again, and we'll just touch on this slightly because Patrick asked this question a little bit further down. He specializes in kind of diabetes, diabetes specifically, and you know, so this is a very clear point of view, which is great. It's amazing to have a clear point of view, a clear expertise. So Patrick will be looking for jobs in managing diabetes in clinics and programs that are zeroed in on diabetes, which only means, Patrick, that you'll have a smaller pool of jobs to pick from, which isn't a bad thing. It's just like any kind of niching exercise. We
Yes.
can't be all things to all people anyway. Let's zero in on what we can do, what we'll enjoy doing. And that means that the work we do get will be much more personally rewarding and you'll be good at it, quite honestly. So the narrower the net that we cast, the fewer jobs that are available, but more growing every year. Um, so that kind of speaks to April's question too about sort of having a dietary preference that's really strongly a dietary belief that's strongly held, or a specialty like Patrick's, which is very narrow.
Gotcha.
That's all.
Okay. Yeah,
Um,
that makes a lot of sense.
there's a lot more questions that have come in, but I think one of them that came up a couple times that I can speak to is opportunities for part-time coaching positions. This came up a bunch of times. There are lots of part-time jobs, and there are tons of part-time health coaching jobs, and 20 to 30 hours a week or off hours. I saw one, there's actually one that I put into the course as an example, and the hours were like 3 p.m. to 10 p.m. 2 weeknights or something. So that's like a long shift, 2 or 3 weeknights. Ended up being kind of it's a long late shift, but if you had a day job that you're holding down and you're trying to get exit that and enter health coaching, that could be something that you could do on the side to get yourself, into the coaching industry and out of your current job. There's tons of part-time jobs. Just that's all I can say to that, is that there are tons. And inside the course, I'll show you how to set up an Indeed.com job search. One of the questions that came in is, what keywords are we searching for? And I literally would search health coach. But understand that some jobs that are listed as health coaching jobs, when you read the job description, it's actually not a health coach you're looking for. They're looking for a dietitian. They're looking for a nurse practitioner. They said health coach because they thought that's what they needed, but they're actually asking for a licensed healthcare professional. Okay, that job's not for me. Click through, find the next job. Great, this one's looking for an actual health coach. The job description is in the realm of coaching and not in the realm of licensed healthcare stuff. Great, that's a job I can apply for. There's part-time, there's full-time, there's virtual, there's in-person, everything and anything you can imagine. I'm not kidding you guys when I say that I get between 5 and 25 jobs per day emailed to me from this job alert that I've set up in Indeed. It's insane. They're not all winners, but there are some good ones, and there's more coming every week. All right. Well, Danny, any parting thoughts here? I do want to let you go, but first of all, I want to thank you, because we could not have created this course without you. And we really felt that this course needed to exist. We couldn't find anything else in the whole health coaching world, health coaching education world, that was teaching health coaches how to navigate the job process. And we were grateful to come across you because you've had such experience from the perspective of hiring. So grateful to you for helping us with this. Any parting words of wisdom for a health coach seeking a job?
I guess I don't know if it's wisdom, but I definitely would just empathize with all of you who are just getting into this space. You're like, I don't have a lot of success in this arena yet. And I would just encourage a lot of you, just that does not mean you're not qualified. It doesn't mean you're not able to do this work. It just means you might be a little harder to get started, like anything, right? It's like it's like the flywheel on the playground. At first, when you start pushing that thing, it's really heavy, and you keep going, and then eventually it starts spinning on its own. You can hop on that thing and just take it for a ride. So I think just, I speak with a lot of new health coaches as well. They're like, how do I do this? And I think just the parting piece of advice, I guess I would say, is you do have to get reps and sets, train anybody, anywhere, anytime, say yes, build lots of bad programming,
Yeah,
build it as fast as you can, just get the sets and reps. And it's a lot easier to get those wins and get a feel for the industry than I think it feels right now for a lot of new coaches.
I love that. And I'd also say that it's not like there's a whole cluster of health coaches that are somehow ahead of you. This whole industry is pretty new. So all you got to do is kind of rev it up a bit and you can rise to the top of the pile of resumes just by putting a little bit of elbow grease in there. All right, great stuff. Thanks so much for this conversation, Danny. Thank you so much for your contribution to our How to Land a Health Coaching Job course, which again will be in the dashboard for all Primal Health coaches coming up here pretty quick. And if you're not a Primal Health coach, make sure you reach out to us to find out how you can get access to it. Because if you want a health coaching job, we're going to show you how to do it. All right.
Awesome.
Have a great day, everyone. Thank you.
Everyone,
Bye
thanks.
bye.